Dr. Sandy Buckman says a second wave of the COVID-19 pandemic is inevitable.
Every pandemic in recorded history has shown a second wave, and it's usually been worse when it's allowed to proceed unimpeded.
So is the province prepared? Doctors say understanding the virus is essential as we reopen. That includes quick access to data about transmission, contact tracing, and testing. Starting today, anyone who is going back to work in Saskatchewan can get tested.
It's actually encouraging to hear that Saskatchewan is inviting people to be tested, and hopefully a lot of people will take up that offer because it's a good one to get the information that we really need to open up.
Dr. Alan Wu was among the first wave of people to get COVID-19 in this province. He's the president of the Saskatchewan Medical Association. Wu doesn't think the public understands how sick the virus can make them. For him, it was 18 miserable days.
You need to be aware that just because we have achieved some success in the last 2 months, that there's still a significant future ahead in terms of a risk for the system and for the population. We can't let up.
Wu says doctors here are anxious about what comes next and that officials are trying to get more personal protective equipment to protect the population. Like Wu, Dr. Corey Nudoff says the public needs to be reminded a second wave could be worse than the first.
Behavior changes so much back to what it was pre-virus that all we've done is delayed a massive second wave by a few months. No system can be prepared enough to handle that. That's what we're all trying to avoid.
Nudoff says testing of active infections will help identify outbreaks, but serological testing is only just beginning, and that's the only way to know how many people might have had COVID-19 and who might be immune. Alicia Bridges, CBC News, Saskatoon.